Well, good morning. It's great to be here with you in person. I'm so excited to get the chance to chat today.
Thank you, Paige. Great to be with everyone.
Absolutely. So just to kind of lay the foundation for the next 20 minutes, can you just talk a little bit more about why Walmart feels like it has a right to be playing in the healthcare industry and kind of what you think the company brings that's maybe unique perspective to some of the biggest challenges we face?
Sure. So the first thing I would say is Walmart's been in healthcare since 1978. And I think people forget that a little bit. The second thing that I would say is we think of healthcare is more than just going to see a doctor. I think we all know that. But I think we forget that in healthcare, we should provide all of those other assets and services as well, which is some of what we're sharing with everyone here today. A long time ago, Clay Christensen coined the term disruptive innovation, which really says, take something that exists and make it more affordable and make it more available to many more people. And Walmart believes we have a right to try to make healthcare disrupted. And we are doing that by providing all of the assets that we have. And our mission is to provide affordable, accessible, human-centered, and I'll come back to that, care to all of our associates and the communities we serve. We have a lot of assets. And so if we believe that social determinants make up 40% of healthcare, personal behavior is another 30% of healthcare, and the actual clinical care is just 20%. Of that 90%, we believe we have a right and are able to play in that space today.
Now, you have a very diverse background across healthcare, but you come to Walmart from a traditional health plan. I mean, on a personal level, I mean, what did you see in retail or in kind of this outside perspective that made you think you could tackle some of these challenges yourself?
So, and you and I know each other for a long time.
We do.
My view on healthcare is that our job as healthcare professionals is to make sure many people feel as if healthcare is something as easy to access as spending time, I don't know, planning their vacation. And we know, by the way, that people spend more time planning their vacation than accessing healthcare. The focus of access means that we have to not stay in our private offices from 9 to 5, Monday through Friday, but actually provide healthcare the way people live. If you're someone who's managing healthcare of a family, you've got a job, you've got children, and you've got tons of other responsibilities. You're probably thinking about healthcare on a Saturday afternoon, and you're thinking of, am I really sick? And do I need to go see someone right now? And if I did need to do that, particularly if you're in a medically underserved area, you don't have enough healthcare professionals. If you're thinking about it in the, I don't have affordable access and transportation, but I know I have to go do groceries, and gosh, I could pick up the glasses for my child. There are very few places besides a Walmart who can do all of that for you in one trip. And my main reason for joining the company, how do we make it easier, and how do we do one-stop access? So I see retail less as different from healthcare, but that more people, when we use the term consumerism, that more people want it all in one place. And what we've heard from our customers and partners is that that's where they'd like to move to as well.
You know, you just mentioned kind of underserved communities and the health disparities therein. I mean, Walmart is the biggest retailer in the country, probably the world as well. There's a Walmart store in everybody's hometown. I mean, how does that enable you to get at some of those challenges, maybe in a way that the traditional system hasn't been able to historically?
So for most people who access healthcare, I'll say it's a privilege for all of us who don't think about healthcare, right? When people say we don't understand healthcare or it's complicated, ask someone who has a child with a chronic illness or someone who gets sick. They understand healthcare. They understand that They know what their copay is. They know if they haven't met their deductible. And medical death, is the #1 cause of bankruptcy in this country.
Right.
And so when you think of health equity, it is not just, can you serve medically underserved areas? It is even the people who have health insurance, can you make sure that they're getting affordable and accessible care? And so from a perspective of health equity, we have about 4,000 stores in HRSA-designated medically underserved areas. In many of those communities, and by definition, an MUA has not enough primary care. For many of those people, they come to our pharmacist. And what our pharmacists need to be able to do is provide care at the top of their license. And for everyone during COVID, we've seen pharmacists do that, so shout out to pharmacists. And then if someone needs a physician, they need to be able to reach them. And that's how telehealth plays a role. So you get a human, and you get that human to be able to connect to a healthcare professional. The last thing that I would say on this is that the ecosystem of care, if we think of social determinants, personal behaviors, and clinical care, we don't need doctors to do personal behavior and social determinant management. And so we employ and utilize community health workers who do a lot of this work. We use care coordinators, obviously nurses and medical assistants. But just think, if 70% of your healthcare outcome is from personal behaviors and it's from social determinants of health, in those two areas, we have a lot of healthcare professionals and lots of companies who can provide that. Walmart is one of those large hubs, and we partner to make sure we're addressing health equity. That, for us, is a major focus of why we're in healthcare.
When I talk to people about this, both in terms of addressing equity in rural communities as well as, minority communities, the term trust comes up a lot in terms of having trust in the providers that you're working with and the people that are giving you the care that you're getting. I mean, how do you see Walmart as uniquely positioned to build that trust and those bridges with the communities that you serve?
Yeah, so in the US, we have about 1.5 million associates. They live in these communities. And I just said that 4,000 of our stores are in medically underserved areas. So the people who work at Walmart, they are from these communities. They are trusted in these communities. And the ways that we partner is we first listen. We hear the needs of our own associates. We partner with leaders in the community, and then we provide services. I'll use just COVID-19 as an example. And probably what, in my short tenure at Walmart, I'm most proud of, we've given out millions and millions of vaccines. 80% of all of the immunizations we've done at Walmart have been in medically underserved areas. 80%.
Wow.
And that requires partnerships. It requires associates who understand the communities, and it requires us being very rigorous in identifying these communities. We utilize an internal algorithm to identify the highest risk communities in the country. We partner with leaders in those communities. We actually published one of these partnerships that we did with a payer in Alabama. And what we've learned in doing these is that our associates actually already know the leaders in those communities. And so if you ask them, they'll point you to who exactly you'll need to speak to so that people know that partnering with Walmart is something that the leaders in the community agree with. So the first is the partnership collaboration. The second is using your existing assets. We not only obviously have the people, but the logistics to be able to do mobile vaccines, to be able to partner with others to go into homes for people who need access into homes. We're going to be giving vaccines in long-term care facilities as well. And then the last of it is not thinking that you've got all the solutions. Even with all of the assets that we've talked about and the multiple events that we've hosted, for each community, it's been a little bit different, right? So when we host something with NASCAR, obviously the trusted voices are different people. And then the ways that you provide it and where, if it's by the food beer stand and it's not at the health center, it's really being nuanced enough to be able to do that. Many people may not be aware of this, but our NPS scores for our Walmart pharmacies, when you talk about trust, and for our Walmart health clinics, have never been lower than 77 to 80. So we've got the trust, we have the service, and we have the people. And people need to see people who look like them, who come from their community. That's a key component of trust. And we're investing in all of those trust areas, if you will, to ensure that people know that we're available. The other thing you have to do when people trust you is be able to make it something that they can get and understand. And so we invest a lot in health literacy. We obviously have some of the lowest prices on any service, and we're continuing to focus on that.
I want to circle back to something that you touched on a little bit earlier, which is telehealth, which has become an increasingly critical tool in addressing these inequities, especially given the context of the pandemic. Could you just talk a little bit more about how Walmart's using that and kind of how you're able to meet these patients where they are virtually?
Yeah, so if you're in a medically underserved area, it's not that you don't want to get access to healthcare, it's that it's not available. There aren't enough healthcare professionals. When we looked at these communities, and I've already mentioned, we've got a ton of access points. What we said is, how do you get them care, not 5 years from now when we build more clinics. We have a number of them today. We're going into Florida next year. But it takes a while to get clinics to all of these places, so you have a physical healthcare professional. Data from the 200 million people who come through a Walmart every week shows that they'd like to get primary healthcare. They're looking for behavioral health. Yes, they've got acute care needs, but those are two gaps that they see and that they'd like access to, and they want it obviously affordable and 7 days a week nationally. And so we said, we understand, we hear you. I think in healthcare we already knew that. We have data from actual people, and we needed to have a tool and a service to be able to do that. We did an acquisition earlier this year. I have to think if it's earlier this year, this year's long, to be able to provide that with someone who is national and provides all of those services, and we're seeing great results and pickup. The other thing that we announced this year is our integration of our electronic medical record. So think about it. You're digitally at home. You get your food and other services delivered from Walmart because you've got Walmart Plus, or you use the app because you get your immunizations there. We have a number of proprietary algorithms, and we know when you come in for your food. What if you're able to get a reminder about your medications, and that we understood the last time you were here, you wondered if someone could explain to you the dosing of medications, and you're bringing in a family member and you'd like them to receive care while they're there. And you'd also, by the way, like to schedule your dental cleaning, and if after you get your medications and your food, it could be at home because you took an Uber, and because it's something that you don't want to carry everything, you'd like it delivered to home. That's not something we have to go build. We now have all of those assets and capabilities and are doing it. And so I would say telehealth is an omni-channel access tool. You still need that human-centered connection for some of this. And you also need to be able to do it anytime that you'd like to. One of the things that we are focused on is not just getting you clinical care, and I'm going to hop on social determinants a little bit, but fresh food and access to fresh food is the largest unmet healthcare need in this country. And so being able to include that as something that we do is as important in your telehealth visit that the doctor asks you or the pharmacist asks you.
You just mentioned kind of the diversity of assets that you have available, and we've seen a lot of different things coming out of Walmart in the healthcare space, the clinics, some of the work in the insurance space with Medicare, the recently announced partnership with Transcarent in the employer space. There's been a lot going on. I mean, where do you see opportunity then in the future potentially? And I don't know, maybe you could tease a little bit of some of the things you're looking at.
So that's Paige knowing more than the rest of the audience. I'd say, look, Healthcare means that from a strategic perspective, that you provide an integrated experience, hence why we're putting everything on one EMR platform, that you're omni-channel, not thinking about you, but the consumer and how they'd like to access care, and you're addressing the things that really drive healthcare cost, but really impact quality of life and clinical outcomes. We believe value-based care is the way you get there in being able to do that. And so for us, it seems pretty simple and clear of what we have to do and should be doing. For us, the innovation and what we're focused on is really how do we make it affordable and accessible. That's the focus. You mentioned our partnership for self-insured employers with Transcarent, but look, we were the first to roll out the digital vaccine record with CLEAR and with the Commons Project. We did the EMR integration. We've done what you're seeing us look at with new assets and new rollout of clinics. We're using algorithms in the way we make sure we're providing personalized services to our customers. And during COVID, I think there's just the realization of that backbone of the healthcare ecosystem that Walmart plays a role in. And so those are all reinforcing for where we need to be and the work that we hope to continue to build out.
We're in our last couple of minutes before we close, but I want to give you some time to just talk about 5-10 years down the road, kind of where you see you and your team going and kind of what you're hoping that you can say you've achieved.
And so one is that when people are getting health care, that we're meeting all of their needs. We believe we can. That we are forming the right partnerships because we do not need to build everything ourselves if we want to provide healthcare today. And you're seeing us announce some of those partnerships. That value-based care is the norm of how we provide services and care across the country. But most importantly, that trust in communities of a place that you can go anytime, 7 days a week, is available to you, and there are people like you who are providing care to you. They understand your needs culturally, healthcare-wise, and they're providing it to you in a manner that allows you to feel like you're getting good access to care. We can do that in America.
So no slowing down, full steam ahead for you and your team.
Slow down.
Well, it was awesome to connect with you, and I really appreciate your time this morning.
Thank you. Thank you, everyone.